Disturbing results tonight about cervical cancer.
A new study says that it's much more common than once thought. CBS 2's Dr. Max Gomez reports the findings could change cervical cancer screening guidelines.
Invasive cervical cancer strikes about 12,000 women a year in this country. Not a huge number compared to more than 250,000 breast cancer cases yearly. That number and about 4,000 deaths a year are as low as they are thanks to Pap smear's ability to detect changes in the cervix well before they become cancerous. But now a new study in the journal Cancer finds that the rate or incidence of cervical cancer may actually be much higher than originally thought. Cervical cancer rates in this country are thought to be just under 12 cases for every 100,000 American women. But the new analysis finds that the real number is actually closer to 20 cases per 100,000, an increase of nearly 60%. The increase is not because there's suddenly more cervical cancer. It's because the rate included women who'd had a hysterectomy.
We've now removed hysterectomy women who've had their cervix removed and are not at risk. So although the numbers are actually the same, the rates have increased because it's spread out over a different population of women.
The increase is even greater for older women ages 65 to 69. That number jumped 85% because more of them had had hysterectomies. Even more concerning is that current screening guidelines say women over age 65, like Carol Beach, are told they don't need Pap smears if their tests have been consistently negative.
This means that my insurance will probably no longer pay for this.
Your Pap test came back?
All negative.
Glad you had it done?
Absolutely.
Still, women in that age group had the second highest incidence of cervical cancer in the entire population.
It just means that we have to sort of keep an eye on women over their entire life cycle and make sure that women who are at risk are still being screened.
African American women in the older age group had an even greater jump in the corrected cervical cancer rates because they have hysterectomies more often with age due to fibroids. Bottom line is all women need to talk with their doctor to decide when and how often they need a Pap test. Dr. Max Gomez, CBS 2 News.
Cervical cancer is caused by HPV, a sexually transmitted virus, but it can be decades after infection before the cancer actually develops.
Well,